Hello, my name's Rebecca and I'm a staff nurse in the Medical Assessment Unit at St Richard's Hospital in Chichester. When I first heard of Lord Darcy's review, I was a student nurse and I really was at a turning point in my nursing career. This was because I'd actually encountered some quite low morale on some of the wards I'd worked on, and it really affected me personally. The low morale spread and it became really infectious, and it really seriously affected the staff I was working with, but worse than that, it went on to involve some of the patients on the ward where I was. I started to ask some people what we could do about it, and nobody could really give me a good answer, so I thought, let's start asking people higher up, which is where Candy came in, and then Lord Darcy and a few other people from my hospital. It became evident when I met Lord Darcy that the real reason and his motivation for doing this review is because he genuinely wants to make things better. He's put his name to this review, which is a very brave thing to do, I think, because he's taking a big risk. The reason I so feel an attachment with Lord Darcy's review is because when we talked, we shared quite a lot of common views about how we loved just delivering patient care. And all this side of it was kind of like the thing we had to do to try and improve things for our patients. But we did both say that we'd really like to be back in our uniforms and back on the wards. I am very lucky. After 3 years of nurse training, I genuinely love my job and I feel very passionate about what I get to do. I'm very lucky that I work in a fantastic hospital, and every day I'm motivated by the people I work with, from the doctors, other nurses, all of the different people I get to work with. But most of all, I am motivated by my patients. My greatest hope for the future is that we can learn new ways of meeting health needs, not by designing the services ourselves, but by listening to what our patients need and really taking the cues from them. As a very junior nurse, it can be hard to get my voice heard. So if I could ask for one thing, please, Candy, it would be a way of allowing my ideas and the ideas of other junior staff to be heard and to be taken forward. I hope that by using imagination and innovation, we will be able to individualise care for patients and make them partners in the service we provide. We have the potential to shape a new, dynamic and very exciting service, and I can't wait to get started.